Welcome everyone to this webinar on pandas and pans for the DPC pediatrician. I'm excited to welcome Dr. Adame. She is owner and pediatrician at Culver Pediatric Center in Indiana. She opened in August of 2020 and has been growing and being really successful in the direct pediatric care space. And she's transitioned over the years kind of what she specializes in. So hopefully you'll share with us a little bit about that. And I'm excited to have you. Thank you so much, Dr. Adame.
All right. Yeah. Well, great to see you again, Dr. Capella. So, I'm very, very excited to talk to your listeners and your members, DPC pediatrician members, about the topic of pandas and pans. And it's, I really hope that it's a valuable time that we spend together. I used to be in academics, so of course I'm going to have learning objectives because you can take the girl out of academics, but you cannot take the academics out of the girl. So these are the objectives that I hope your listeners will reach by the end of this talk. We're going to talk about the diagnostic criteria for PANS and PANDAS. We're going to discuss causes and triggers. We're going to discuss treatment. We are also going to identify non-pharmaceutical holistic interventions in the management of PANS and PANDAS. We are also going to talk about the things that you might not find in the Pandas Physician Network algorithm. And that is, for example, the impact of medical trauma in a lot of the families who have been affected by PANS or PANDAS. So this definitely affects the way we approach these families and how we treat them. So it would be a disservice for me not to at least mention this. And then I'm going to give an example of my clinical and procedural workflow as far as the onboarding and the follow-up for these families, because there's definitely some nuances there. And then I'll talk about compensation models too. All right. So first of all, what is PANS and PANDAS, and what is the difference between PANS and PANDAS? First of all, think about it this way. All PANDAS is PANS, but not all PANS is PANDAS. We have to think of PANS and PANDAS as a misbehaving immune system and chronic inflammation. And the acronyms are right there in that little PANDAS, funny slide. But PANDAS was first identified in 1998. I remember being in my microbiology class in medical school. I must have been a first year in 98. Yeah, I was a first year medical student. And the professor was lecturing on the complications of strep. And she had a slide that included rheumatic fever, post-strep glomerulonephritis, and PANDAS. PANS was first identified a bit later in 2012, more than a decade later, in order to expand the diagnosis, because studies showed that there were children who met all the clinical criteria for PANDAS, but did not have signs of a strep infection. When the neuropsychiatric symptoms are due to strep, we call the condition PANDAS. When they are due to any other trigger, and it could be infectious like COVID, like mycoplasma, like Lyme, it could be allergies, it could be other things, then we call it PANS. And for the purposes of this webinar, I am going to use the terms interchangeably. So first, let's talk about diagnosis. And I have to say this, PANS and PANDAS, it is a clinical diagnosis. Yes, we're going to talk about lab work. Yes, we're going to talk about all these other diagnostic modalities. But ultimately, like rheumatic fever, like Kawasaki disease, it is a clinical diagnosis. This is how I have had some of my older children describe how they feel when they are affected by PANS and PANDAS. I feel like my brain is on fire. I feel psychotic. These are the terms that these children and adolescents are using to describe how they feel. It really is an illness, a condition that once they're affected, it changes their whole life. It turns their world upside down, and we have to be very. That's why we really have to treat these families with the dignity and the respect that they deserve, like all patients, of course, but with the understanding and the nuance that some of these families have, by the time they come to us as a DPC pediatrician, they've been through a lot, and their child has been feeling like this for quite a while, like their brain is on fire.